Many of my patients come to me having already tried something like this. They read about it online, or a neighbor mentioned it, or they found it in some health forum at 2 in the morning when the burning in their feet wouldn't let them sleep. 3 specific seeds, and they tried it, and some of them actually felt something, a little better, a little relief. And then, within a few days, it faded, and they were back where they started, wondering what they did wrong. Here's what I want you to understand before anything else. You didn't do anything wrong. Those seeds, flaxseed, sesame, pumpkin, contain compounds that do interact with your nervous system. Anti-inflammatory fatty acids, magnesium, zinc. There's a real biological basis for why you felt something. But here's the part that nobody explains to you. Those seeds were touching the surface of a problem that goes much, much deeper. And if you don't understand what's really happening beneath the surface, you will spend years chasing temporary relief while the actual damage continues silently every single night. Stay with me, because what I'm about to share could be one of the most important things you hear about your health this year. I've been working with patients over 60 for decades, and I want you to really hear this. The tingling, the burning, the shocking feeling that shoots through your feet at night, that is not normal aging. I don't care what you've been told. That sensation is your nervous system sending you a distress signal. It is telling you something is actively wrong. And when I see patients who have been living with this for 5, 7, 10 years, managing it, enduring it, pushing through it, I feel a deep frustration, not with them, with a system that handed them a prescription and called it a day. If you are over 60 and you feel that constant buzzing in your feet, that low-grade electrical hum that never fully goes away, if you wake up in the middle of the night and your feet feel like they're on fire, if you've started walking more carefully, grabbing door frames as you pass through rooms, hesitating at the top of stairs, I want you to know that I see you, and I want you to understand that what you are experiencing has a specific biological cause, a real one, and it is treatable. Let me describe something that I hear from patients constantly. You go to bed at a reasonable hour, you're exhausted, but 20 minutes later, the burning starts. It moves from your toes up through your feet, sometimes into your calves. You shift position, you put your feet outside the blanket, you get up and walk to the kitchen. It eases slightly and then returns. You finally fall asleep around 2 or 3 in the morning, and you wake up unrefreshed, foggy, irritable. And you do this 3, 4, 5 nights a week. And nobody, not your doctor, not your specialist, has given you a real answer for why this is happening. They gave you gabapentin or Lyrica or some combination of things that made you feel dizzy and slow and still didn't stop the burning. And somewhere deep down, you started to wonder if this is just what the rest of your life looks like. I'm asking you not to accept that, because there's something happening in your nervous system that was never properly explained to you. And it's fixable. Think about the wiring in your house. Those electrical cables have a thick rubber coating around them. That coating exists for one reason: to keep the signal inside the wire clean and contained. Now imagine that rubber coating starts cracking, deteriorating. The electrical current doesn't travel cleanly anymore. It leaks. It sparks. It creates interference. Your body experiences that as tingling, as burning, as those sharp, sudden shocks that come out of nowhere when you haven't touched anything. Your peripheral nerves, the ones that run from your spinal cord all the way down into your toes, are wrapped in exactly that kind of protective coating. It's called myelin. And in a significant percentage of people over 60, that myelin is breaking down, not because of aging alone, but because of a specific set of nutritional deficiencies and inflammatory processes that are almost entirely correctable when you know what they are. Here's what makes this even more urgent. And I want you to stay focused, because this is critical. The deterioration of that myelin sheath is not a visible process. You can't see it. You can't feel it happening in real time. What you feel is the result, days, weeks, sometimes months after the damage has already occurred. This means that by the time you feel that burning intensify, by the time the numbness spreads further up your foot, the underlying process has already been progressing for a long time. And that is why waiting is never the right answer with neuropathy. In my years working with patients over 60, I've seen this pattern over and over again. A patient comes in. The tingling started 2 years ago in just the toes. Now it's the whole foot. Now the ankles. Now they're having trouble feeling the ground when they walk. They trip, they stumble. They've stopped going for evening walks because they don't trust their balance anymore. They've stopped dancing at family events. They stopped playing with the grandchildren on the floor because they're not sure they can get back up. And they look at me and they ask, "How did it get this bad?" Why didn't anyone catch this sooner? And the honest answer is, because the conventional medical system is not designed to treat the root cause of neuropathy. It's designed to manage the symptom. And there is a significant difference between those two things. What most doctors won't tell you in a 10-minute appointment is that peripheral neuropathy, in the majority of cases in people over 60, is driven by a cascade of deficiencies and inflammatory damage that begins years before the first symptom appears. Three specific mechanisms are responsible for most of what my patients experience. The first is myelin degradation, driven by severe vitamin B12 deficiency. Not mild deficiency, severe chronic long-standing deficiency. After the age of 60, the stomach's ability to produce intrinsic factor, a protein essential for B12 absorption, declines sharply, which means even if you're eating foods high in B12, a large portion of it is simply not being absorbed. And if you are taking metformin for blood sugar management, the situation is worse. Metformin actively blocks B12 absorption in the gut. Studies show it reduces B12 levels in up to 30% of long-term users. This is not a footnote. This is a direct causal link to the destruction of the protective sheath around your nerves. And yet, and this still astonishes me, the majority of patients taking metformin have never once been told by their prescribing physician to monitor their B12 levels. The second mechanism is oxidative stress. Your nerve cells, like all cells, produce waste products as they generate energy. Normally, antioxidant systems inside the cell neutralize that waste. But after decades of accumulated stress, poor sleep, blood sugar fluctuations, chronic low-grade inflammation, those antioxidant defenses become depleted. The waste products, called free radicals, begin damaging the nerve cell from the inside out, starting with the mitochondria, the energy center of the cell. When the nerve cell can't produce enough energy, it can't maintain itself, it can't repair itself, and it can't transmit signals cleanly. You feel this as burning, as electrical shocks, as the sensation that something is deeply wrong. The third mechanism is vascular compromise. Even in people who are not officially diabetic, elevated blood glucose, even at the pre-diabetic range, damages the tiny capillaries that supply blood to peripheral nerve fibers. These vessels are microscopically small. They are among the first casualties of metabolic dysregulation. And when they narrow or close, the nerve fibers they feed begin to starve. This is why neuropathy and diabetes are so closely linked. But it is also why millions of people with blood sugar in the normal range are still developing neuropathy, because the threshold for vascular nerve damage is lower than most physicians acknowledge. Researchers at major institutions have published findings on this, findings that most primary care physicians have simply not had time to incorporate into their practice. What the data consistently shows is that when these three mechanisms, myelin breakdown, oxidative nerve damage, and microvascular compromise, are addressed with targeted nutritional support, the peripheral nervous system demonstrates a remarkable capacity to begin recovering. Not immediately, not overnight, but progressively, measurably. If what I'm sharing today is new to you, and I suspect it is, make sure you subscribe to this channel. I release critical health information for people over 60 every week, information your doctor may not have time to share in a routine appointment. Hit the subscribe button below. It costs nothing, and it could be one of the most important health decisions you make today. I had a patient, I'll call her Margaret, 71 years old. She came to me after 4 years of burning feet. She had tried 2 different medications. One made her so dizzy she fell getting out of bed and bruised her hip. The other gave her brain fog so severe her daughter thought she was developing dementia. She had tried B12 supplements from the drugstore. They made no difference. She had tried the seeds. She had tried soaking her feet. She had tried everything she could find online at midnight while her feet kept her awake. She came into my office convinced that this was permanent, that this was just her life now. We ran a full nutritional panel. Her methylated B12 was critically low. Her alpha lipoic acid markers were deficient. Her vitamin D was in the floor. We addressed each of those deficiencies in the specific forms that actually reach nerve tissue. Within 6 weeks, she slept through the night for the first time in 2 years. Within 3 months, she told me she had started walking in her neighborhood again. Not because the pain was completely gone, but because it was manageable, because it was improving, because for the first time in 4 years, she felt like the trajectory had changed. I want you to understand something about what neuropathy actually takes from people, because we talk a lot about the physical symptoms. We don't talk enough about the rest. rest. We don't talk about what it does to your sleep. Not just one bad night, but years of fragmented, unrestorative sleep that erodes your mood, your memory, your patience, your will. We don't talk about the isolation, the way people stop going to dinner with friends because the walk from the car to the restaurant feels risky. The way they stop traveling because airports and new environments feel dangerous when your balance is compromised. We don't talk about what it does to a person's sense of identity. The man who used to go hiking every Saturday morning with his son. The woman who used to tend her garden every evening after dinner. The grandfather who could chase his grandchildren around the yard. These are not small losses. These are the things that make a life feel worth living. And neuropathy steals them quietly, gradually, in ways that are so easy to rationalize. I'm just getting older, that's all. Until one day you realize you've stopped doing almost everything that brought you joy. And the medication you were prescribed is still sitting on the nightstand. And nothing has changed. The link in the description below takes you directly to the natural nerve support formula I recommend to my patients. It combines everything I've covered today in the specific forms that actually reach nerve tissue. Take a look when you have a moment. I think it will make a lot of sense after what you just learned. Now, let me tell you what the research increasingly supports as the foundational nutritional intervention for peripheral nerve health. And I want to be clear, this is not about one magic ingredient. It is about addressing the full cascade of deficiencies that drive neuropathic damage, simultaneously, in the right forms. The single most important nutrient for nerve health, and the one that most people over 60 are severely, critically deficient in, is B12. But not just any B12. The form matters enormously. Cyanocobalamin, the synthetic form found in most cheap supplements, is poorly absorbed and cannot easily cross into nerve tissue. What the research supports is methylcobalamin. The methylated, bioactive form that penetrates nerve cells directly, supports the synthesis and maintenance of myelin, and has been studied extensively for its role in nerve regeneration. In my patients, the difference between cyanocobalamin supplementation and methylcobalamin supplementation is not subtle. It is significant. If you are over 60 and taking a B12 supplement, look at the label right now. If it says cyanocobalamin, you are likely getting very little benefit for your nerves. The second compound I want you to understand is alpha-lipoic acid. This is an antioxidant, unlike the ones most people are familiar with. What makes it extraordinary is that it is both fat-soluble and water-soluble, which means it can penetrate into parts of the cell that standard antioxidants like vitamin C or E cannot reach. Specifically, it works inside the mitochondria, the energy engine of the nerve cell, neutralizing the oxidative damage that accumulates there over decades. It also has a unique ability to recycle other antioxidants in the body, amplifying their effect. Clinical evidence points to alpha-lipoic acid as one of the most relevant natural compounds for supporting peripheral nerve health. The form matters here as well. The R form is the biologically active version. S form is a synthetic byproduct with far less activity. Most cheap products use the cheaper racemic mixture. The research consistently favors R-alpha-lipoic acid. The third compound is acetyl L-carnitine. Think of this one as the fuel delivery system for nerve repair. Damaged nerve cells require significant energy to begin the repair process. Acetyl L-carnitine facilitates the transport of fatty acids into the mitochondria, where they are burned for energy. Without adequate acetyl L-carnitine, nerve cells lack the metabolic resources to respond to repair signals. Studies have examined this compound in clinical settings specifically for peripheral nerve support, and what researchers have observed is that it appears to support both nerve regeneration and the relief of neuropathic symptoms, particularly the burning and electrical pain sensations. Finding each of these compounds separately, in the right forms, the right doses, and the right combinations is not easy. Most people over 60 don't have the time or the knowledge to navigate that process on their own. That's why I've left a link in the description to a formula that brings all of this together. I've reviewed it carefully, and it is one of the few options I feel comfortable recommending to my patients. Now, you might be wondering, if this information is available, if the research supports it, why hasn't your doctor mentioned any of this. I want to be direct with you, and I want to be fair. This is not a conspiracy. Your doctor is not withholding information maliciously. The problem is structural. Medical training is organized around pharmaceutical intervention. A doctor in a 10-minute appointment is equipped with a prescription pad and a set of guidelines built around drug trials. The research on nutritional support for nerve health exists, but it doesn't move through the same channels. It doesn't get promoted by pharmaceutical representatives. It doesn't appear on the clinical guidelines that most physicians are trained to follow. And so, millions of people over 60 are sitting in exam rooms with burning feet, and they are walking out with gabapentin, a drug that reduces the perception of nerve pain by suppressing neural activity across the board, but does nothing to address the underlying damage. And in some research, may actually impede the natural recovery process over time. This is not your fault. Nobody told you this. And now you know. You are not powerless here. Your nervous system has a remarkable capacity to respond when given what it has been missing. The burning, the tingling, the shocks, these are signals from a system under stress. But stress can be addressed. Deficiencies can be corrected. Damage, addressed early enough, can be substantially reversed. I have watched patients who came to me resigned to a life of pain begin to reclaim things they thought were gone. Sleep, balance, confidence, the ability to walk their neighborhood, the ability to be present with their grandchildren without fear. And the next time you think about those seeds, or whatever has given you temporary relief along the way, I want you to remember what I shared today. Those seeds were not wrong. They were just the beginning of a question you now know how to answer, because now you understand what is actually happening inside your nerves and what is actually possible when you give your body the specific support it has been lacking. If today's video opened your eyes to something important, share it with someone you care about, because there are millions of people over 60 dealing with this silently, and they don't have to. The link in the description goes directly to the natural formula I recommend. Take a look when you have a quiet moment. Subscribe for more critical health information every week. And leave a comment below. What was the most surprising thing you learned today? I read every single one.